Your Health is brought to you by If Your Mouth Could Talk by Dr. Kami Haas, an in-depth guide to oral health and its impact on your entire life. Available at themouthbook.com.
Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're discussing National Nutrition Month, but before we give you some healthy eating tips, let's take a look at what's coming up on the show. How one rehabilitation center is getting people back on their feet, and a book that teaches about the connection between oral health and overall health. Plus, we bust the myth of good fats versus bad fats. All that and more in this episode of Your Health. What we eat impacts our health in many ways, so during National Nutrition Month, we thought we'd share some practical and easy steps to get your eating on track. The first thing you should do is shop smart. Studies show if you eat a healthy meal before you go to the grocery store, you'll make healthier choices. And always bring a list and stick to it. If you don't have unhealthy foods in the house, you won't be tempted to eat them. And we've all heard it, cut back on refined carbs. White flour, pasta, and bread are low in fiber and digest quickly, so you feel hungry sooner. Instead, choose complex carbs like oats, grains, and veggies. Studies show that fewer than 1 in 10 children and adults eat the recommended number of vegetables a day. So try to make half of your plate veggies or fruits. Eating these foods will provide necessary vitamins and minerals, and most are low in calories. Another simple swap you can make is water for those sweetened sports drinks and soda. The added sugar, calories, and artificial colorings can lead to weight gain if you consume too much. And snack smart. Bring pre-portioned mixed nuts with you for the day, so when you get hungry, you're not tempted to reach for those unhealthy items. Research shows people with healthy eating patterns live longer and are at lower risk for serious health problems like heart disease, diabetes, and obesity. So during Nutrition Month, commit to making small changes and your overall health will benefit. After an illness or accident, getting back to your life can be difficult. The doctors at Opelousas General's Rehabilitation Center have a team approach to assist in your recovery.
What a patient can expect when they come onto the inpatient rehab unit is to be involved in an interdisciplinary team of professionals and wonderful caring people here on our Opelousas General Rehab Unit. We have physical therapy, which is going to help them with motion. We have occupational therapy, which is going to help them with what we call our activities of daily living, or our ADLs, which are the things we all need to do when we get up every morning. Washing our face, brushing our teeth. Some have to brush their hair, others are more lucky.
Patients qualify for inpatient rehabilitation because they have a significant functional deficit. And that's what makes them available to come over here or qualify to be admitted. The holistic approach that we use to treat our patients here include a whole team of persons attending to the patient's need and reassessing it on a daily basis, almost on an hourly basis. Inpatient rehabilitation benefits the patient by providing them the ability to return back to their functional level or better than they were before whatever happened brought them here. Our goal is to make the patient as functional as we can and to bring him back to his baseline before whatever brought him here was, or even better. And we do that by approaching all of his or her medical problems and physical problems.
Everybody that comes up on rehab has had something taken away from them. I always say that they've had something they never thought would happen to them, and it's already happened. Whether it's a stroke, or whether it's an amputation, or whether they've fallen and broken a hip, and they've had their autonomy and their ability to do for themselves taken away. And we are blessed to be able to help them on the beginning of this journey, them and their families, back to their independence.
The treatment modalities for inpatient rehabilitation are global. They include physical therapy, occupational therapy, speech therapy, nutritional support, and of course medication. The conditions that respond excellently well for inpatient rehabilitation are mainly strokes, because they do give you a lot of deficits, followed by complete hip replacements and knee replacements. But also other conditions such as being debilitated and weak from an extended hospital stay due to a catastrophic infection.
Dr. Alamani and I try to not be doctors, but be healers, because that takes everything. And thankfully, we have such a great team that we're all able to help them on their emotional journey getting through this, as well as on their spiritual journey getting through this. And not only get better, but see better. See that they have a future where they will be able to do for themselves again.
Here's an easy nutrition tip: slow down. The pace you eat actually can influence how much you eat. Studies show that faster eaters are more likely to be obese. It takes your brain about 20 minutes to receive the hormone message that you're full, so slow down and enjoy your food. Stick around, here's what's coming up on the show. We talked to the author of a new book educating us about the importance of oral health and how one organization is helping to empower those who are deaf and hard of hearing. For 25 years, a super dentist has been a leader in pediatric dentistry, and now their co-founder has written a book to educate us about the connection between oral health and whole body health.
So I became a dentist because I just love science and I love art. I have a music background, so I wanted to do something that I can use the hand dexterity that I've developed, through my musical training. We've had a practice in San Diego for 25 years. It's called the Super Dentist, and we're by far the largest group pediatric dental practice in San Diego with locations all over the county. We have a group practice with world-class pediatric dentists, orthodontists, general dentists, and other specialists, all working alongside each other. For over 2 decades, I've had parents ask me the same questions on a daily basis, right? Hey doctor, isn't my child too young? Or isn't that just a cavity? Or isn't that just a baby tooth? And so some of these questions required that I wanted to sit down and explain things a lot more. But usually in a dental setting, we don't have that much time to explain things, for a long time. And so I decided to put all of this information in one place. I wrote a book. Title of it is If Your Mouth Could Talk. Because if your mouth could talk, it would tell you about the condition of your entire life. This book is not about brushing and flossing, nor is it about all those general things that you can learn at your dentist's office. This book is about a health crisis affecting 3.5 billion people, almost half of the population of the world. And it's not COVID, it's dental diseases. Right now, the oral care marketplace is a mess. You get a random toothpaste from this company, and a random mouthwash from this one, and the toothbrush from Amazon, right? And so we decided to organize this and launch a new company called Supermouth, which is a subscription model of oral care. These products that we've developed follow the 5 rules in our company. S-U-P-E-R, super. S for safety. All the oral care products that you want to put in your mouth and the mouths of your kids, of course, have to be safe, right? U is for unified. The oral care products that we have, they all work together as a system. P is for playfulness. We want the kids to grow up loving taking care of their mouth and build positive associations with their oral care. E is for effectiveness. Obviously, we want to make sure that they work, right? And R is for reputable. Right now, you get your information from Google or from Amazon or random person on social media. But we want to be the trusted advisor for parents. And so we want to be proactively educating parents, providing the tools and the oral care products to make sure they can raise healthier, happier, more successful kids. The education piece is a key piece in our company. We want to make sure that we educate parents, because if you're educated as a parent, you're going to do the right things. And so my book, If Your Mouth Could Talk, one of the most important reasons why I wrote it is to make sure that I provide that education to the parents so they know what to look for, and they can not only be healthier themselves, but they can provide their children with brighter and happier futures. People can find my book, If Your Mouth Could Talk, on their favorite bookstore, or they can go to my website, themouthbook.com, and purchase the book there, and also get some special gifts to go along with the book.
The Arizona Commission for the Deaf and Hard of Hearing worked to ensure that those in the deaf and hard of hearing community have the resources they need to improve their quality of life.
There are over 1.1 million Arizonans who have varying hearing levels. That's 18% of the population. And those are people who are hard of hearing, deaf-blind, deaf, or have a combined vision and hearing loss. some of the biggest misconceptions about hard of hearing and deaf people, and I'm hard of hearing, is that, with us hard of hearing people, we're always offered sign language interpreters. And sign language interpreters are great for deaf people, but for hard of hearing people, that's not what we need. What we need is captioning, and real accurate captioning. And we also need assistive listening devices, really good communication skills and strategies. And what we hear from our deaf colleagues and deaf community is that so many people think that just writing in English to them or having them lip read is okay, when they really do need sign language interpreters. ASL, American Sign Language, is its own unique language with its own distinct grammar and syntax, and that's really what they need for full accessibility.
The services offered at ACDHH begin with information and referral. We also provide consultation and advocacy services. We have specialists in the areas of deafness, hearing loss, and deaf blindness, and we provide family supports as well. We license American Sign Language interpreters, and we have a hearing healthcare program that provides resources about the purchasing of hearing aids, as well as the telecommunications equipment distribution program and the Arizona Relay 711 services.
For here at the Commission, we do have the Arizona Telecommunication Equipment Distribution Program, and this is for folks maybe hard of hearing, deaf blind, or may have a combined vision and hearing loss. And we have a lot of great equipment to help people who may need assistance on the phone. We have amplified phones, we have a captioning phone, we have a lot of great flashing and alerting devices, vibrating devices to help people to navigate their environment. And so it's a wonderful program. It's free, it's really easy to apply. You can apply right on our website and see all of the devices available, and we have an easy application, and we hope you'll check it out.
So the relay service and the phone equipment program work hand in hand. The relay service enables you to make phone calls, and the assistive devices that we provide through the phone program, the speech devices, the TTY, the amplified phones, the caption phones, connect to the relay service. So they really work together as one.
You can learn more about ACDHH by visiting us at our website at acdhh.org. We're also active on our Facebook, Instagram, and other social media platforms.
Another nutrition tip, fill up on fiber. Studies show that eating fiber-rich foods will help you lose weight and keep it off. It's as easy as adding beans to your salad or eating oats for breakfast. Here's what's coming up on the show. We visit the largest proton therapy facility in the world to see how they are fighting cancer. And is all fat bad for you? We get the answers. We take a look at the Hampton University Proton Therapy Institute and how they're helping in the fight against cancer.
There is no proton institute throughout the world that is as large and as most advanced as Hampton University Proton Therapy Institute. It's a fantastic place.
Since our founding, 1868, we've been trying to help people. We try to look out for people, look out for everyone, including the downtrodden. Even though we did not have a hospital or a medical school, we didn't need it because this is a self-contained unit. We've got physicians on the staff, we've got medical physicists, we've got nurses, we've got therapists, we've got people like that. And so those are the kinds of things that satisfy me when I think about this wonderful center, when I think about the people that are here, that come, who have faith and who have confidence in us, and we actually save their lives. Black men had a 72% higher incidence rate of prostate cancer than do white men. So one of the things that I say to Black and white men, they need to go to the doctor. They need to get checked. They need to let the physicians take their blood They need to be able to get the physical examination so that they can see, because prostate cancer is 100% curable if you catch it in time.
Portsmouth has the highest death rate of prostate cancer in the state of Virginia. This being Black History Month, I think that they ought to, not only African Americans, but others too, should look at this building here as more like a shrine toward what HBCUs can do to help mankind. It's not a black thing nor a white thing, it's a health thing. After what I went through here, and with no erectile dysfunction, no incontinence, no other side effects, I feel like I am Lawrence Davis 2.0. The old version is gone and the better and improved version is here. We've got a mecca of a place here that solves problems, takes care of your cancer, and also takes care of you mentally and emotionally when you walk through those doors. If I didn't have these glasses on, you'd probably see tears rolling out my eyes right now, because I'm so thankful of what they have done for me and for others too.
Finding a place for our loved ones as they age can be difficult, but at Avenir Senior Living, they're setting the bar when it comes to individualized care.
The origins of Avenir Senior Living really start from a family-based business. The company was founded by David and Violet Craik, and they started this company through their own personal experience. They had a loved one that was in a senior living community that they were not super satisfied with, and decided, because of their background in construction and design, that they felt that they could create a retirement community, a memory care community that was really deserving for their loved one. So what makes Avenir Senior Living very different from all the other companies in the senior living industry is we are a smaller boutique style company. Being a boutique style community or a boutique style management company allows us to really work closely with not only our management team and staff, but also our families and our resident families as well. Our resident really is our customer, but our customers really start with our family connections. So we work closely with our families to help support them with resources and education, because a lot of our families are coming into this situation without a very good knowledge of dementia. So we utilize our expertise and our contacts and resources in the healthcare industry to help these families navigate this journey. Some of our programs that make us very different from our other competitors is our cognitive lifestyle program. This is a program that's unique to Avenir Senior Living. And what it is that we assess our residents and we align them with other residents in our communities through their cognitive levels. So in our communities, we have an early cognition community neighborhood, an intermediate and advanced neighborhood. And what this does, this allows us to have our residents living with peers who have the same abilities and likes, and this allows us to then set up successful days through activities and socialization, which really helps to enhance their enjoyment of their day. A typical resident day here really will start with a nutritious meal. So our chefs are all our employees who work with registered dietitians to make sure that our meals and our menus offer a wide variety of nutritional options. We can also manage specialized diets if a resident needs one. Further to that is the socialization throughout the day. So activities that are really geared toward each different resident's abilities so that they have success throughout their day and it's very rewarding for them. Avenir really prides itself to be a pillar in the communities, so we want our families to know that they're welcome to come to any Avenir community. We will help them to our best of our ability, utilizing our resources and our connections to help educate them. The best way for somebody to learn more about our company would be to visit our website or to phone any one of the 3 communities here in Arizona. It's really important for people to know that they're not alone in this journey and that Avenir Senior Living is here to help.
Don't go away, we have more Your Health coming up. We tell you the types of fats you should be incorporating into your meals.
Your Health is brought to you by If Your Mouth Could Talk by Dr. Kami Haas, an in-depth guide to oral health and its impact on your entire life. Available at themouthbook.com.
Chance to talk with Dr. Schott about the myth that all fat is bad for you. He shares whether that's true or false.
The answer is that fat is good and bad, and it depends really on how you prepare the fat, where the fat comes from, and what kind of fat it is. Let's start with what is good fat, because for many years we thought that all fat was bad. And the reality is that when we had a head-to-head study from the American Heart Association, at that time low-fat diet versus the Mediterranean diet, the results were so impressive that they actually had to stop the study in the middle of it because the people in the Mediterranean diet group had such great benefits for their heart, with less heart attacks, less strokes, lower blood pressure, lower cholesterol, and they were just doing so well that it was unethical to continue the study. And so what we learned from that and subsequent research is that there's good fats that we need actually. Fat is a critical part of heart health, brain health. Every cell in our body needs fat. The question is what kind of fat? And the best fat is actually plant-based fats that come from nuts and seeds, avocado, and then also followed by that is fatty fish, wild seafood, the healthy fat that comes in wild salmon, for example. Or omega-3 fish oil. Obviously, extra virgin olive oil is a plant-based fat that's also really good. Bad fat is actually processed fat. Fat that is like hydrogenated oils and other kind of ingredients of solid fats that are in processed foods. And also any fat, even the best extra virgin olive oil, if you cook it past the smoke point where it starts smoking, you actually damage the fat. And that damaged fat goes into our bloodstream and then it basically oxidizes and further damages our LDL cholesterol, causing inflammation, which eventually leads to the process of atherosclerosis and narrowing of our arteries that leads to heart attacks and strokes. So that's why the issue of fat is more complicated. Looking at what kind of fat is the most important question.
Thank you for joining us on Your Health. We hope you have a healthy and happy day. I'm Erica Cardenas. See you next time.